Mr. Leon Pereira.
Question 20, please.
Into account the World Health Organization's air quality guidelines as well as studies on the health costs of air pollution to formulate air pollution mitigation policies to safeguard public health. As the studies differ in their methodologies and assumptions, we are unable to provide specific information on the annual mortality or health costs associated with air pollution in Singapore. Nonetheless, it is clear that reducing emissions of air pollutants benefits Singaporeans.
Mr. Pereira.
I thank the SMS for her reply. Just a few supplementary questions. Firstly, no doubt there are differences in the methodologies used in these studies. Would the government consider developing a particular yardstick based on the methodological best practices out there in order to derive an estimate for what is the health impact, the mortality impact of air pollution? My second SQ is what policy levers are available to the government and what policy levers does it use to induce facilities that emit air pollution to scale back and reduce that air pollution? And this is important given the effects on human health, which can be particularly bad for industrial air pollutants. Thirdly, what is the progress of the government towards achieving the WHO guideline for PM 2.5 pollution in the air, which I believe the government has stated as a goal? And lastly, when does the government estimate we would be able to hit this WHO preferred guideline for PM 2.5 air pollution? Thank you.
Thank the members for his 4 supplementary questions. Firstly, about developing guidelines or parameters, basic parameters, and to undertake a study to measure the impact of healthcare costs. As I've said, and you have also noted, the studies, there are actually many studies available locally as well as overseas. And most of them have very different methodologies as well as assumptions. And in fact, it also varies according to the context. And indeed, actually, for a parameter, for instance, a value of statistical life that is used to estimate, health costs in terms of mortality. Actually, there is quite a bit of debate on this itself, and in fact, misunderstanding even among the academics. And given this, as well as the fact that such studies are actually multidisciplinary, so you need experts in epidemiology, economics, and so on, and you will spend many years. These studies are therefore, specific to each different context, and hence we continue to look at these studies and consider the findings. And if at the end of the day, if there are actually some methodology which we think would be useful, we could consider that. Yeah, but at the current moment, we think that what is important really is the fact that there is global scientific consensus, as articulated by WHO, that there is significant impact of air pollution on healthcare and health itself and the cost. And therefore, we actually undertake very robust measures and policies to safeguard our air quality. And actually, we have done that for years. You have also asked about policy levers. Actually, we do have many policy levers. For domestic sources of air pollution, the key sources will be industries as well as, of course, vehicles. And we have been tightening emission standards, industrial emission standards as well as vehicles. And for vehicles, now we have a policy not just to 2040, no more ICE cars, for instance. That will help to improve air quality, in particular particulate matter too. The other thing we need to consider, so we will continue to tighten measures and regulations as much as we can. But one thing we also need to understand is that for small island country, city-state like Singapore, our sources of pollution are not just domestic, which is generally something that we can better control, but also transboundary. And in any measures that we implement, we also have to consider that. Progress to achieve the WHO quality standards as in our Sustainable Singapore Blueprint 2015. We have not quite reached for PM 2.5. We have achieved the standards for some of the other pollutants, but not PM 2.5 or 10. But as I've said, we are working on looking at how we can continue to improve. And as we implement and encourage the adoption, say, of cleaner vehicles, that will also help us with the index for PM 2.5. I think that's about it, right? Number 4, who? I think I've answered that too.